Spesihle Mavundla is at her wit's end. Her 3-year-old daughter, Enhle, developed an eye infection or allergy in December.
She got this eye problem. Her eyes become red, especially when it's hot. It becomes very, very red and it's itchy. So I've decided to take her to the hospital, the local hospital, which is also in the Swen Hospital. Then the doctors transferred us to Makot Hospital to see the hospital that are dealing with the eyes problem. So we went there, the doctor examined her and she gave us the prescription to fetch it. It's also in the Swen Hospital for 6 months.
But Osindisweni Hospital near her home in Ndwedwe didn't have the eye drops prescribed for Enhle. This note from the hospital in December confirmed that the medicine was out of stock. Since then, Mavundla's tried to get the eye drops, to no avail.
So currently, ever since they transferred us to pick up the medication, we haven't got the medication. From December, January, February, and it's March now. I've been trying to call us in the Swen Hospital to see if they still get the medication, but the answer is that the government doesn't have the medication. It's out of stock.
Mavundla's experience is in stark contrast with what the health department said in mid-February, that they've resolved the medicines shortage issue, and they've also denied that there were continued shortages. At the time, the department made an unannounced visit to the Provincial Pharmaceutical Supply Depot in Clarewood in Durban. The management of the facility said that they were managing the stock strictly to avoid wastage and that they haven't stopped placing orders and distributing to various health facilities. Again, it's not what Mavundla found.
I went to Dr. Pisley Waseme. I've called Tongati Clinic. I've called Magandi. Still they don't have. They said they don't have it at the back. So I don't know how we're supposed to get help if the medications are out of stock.
Another family from Durban says their sister developed spinal tuberculosis. She was admitted to Christ the King Hospital in Ikobo. But after a month in the hospital, they saw her health deteriorating.
But then things got worse day by day, and then until we had to sign her out because we could see that she's not getting any better. She was struggling. Yeah, they were using the term OS, which we didn't know at that time until we did the research that they meant out of stock. So there was no medication for her at that hospital.
Against the protestation of the hospital, they insisted on moving her to a hospital in Durban, where her condition has now improved. The Provincial Treasury says the dire financial situation in the province is due to the massive 70 billion rand cut to the provincial budget over the last few years, which was a result of poor decision-making by the national government.
70 billion rand is half our annual budget. Now, that's got to impact, and we're seeing that impact now on frontline departments such as health, such as education, and such as social development. So what we've been trying to do in the very short space of time that we've been in government is to reprioritize as best we can to try and protect those frontline departments. Obviously, the 25-26 budget comes out now. We're going to continue that process. So it's unfortunately going to be a slow recovery.
But this means very little to Mavundla, who continues to wait for her child's medication, concerned that her daughter's eye condition may have lasting consequences. However, there's been some good news. For the first time since 2021, the province faces no budget cut in the allocation from the delayed national budget to be delivered on Wednesday. Renee Heine, SABC News, Durban.